Psychological interventions such as cognitive behavioral therapy, CBT, emotional processing techniques, and other forms of therapeutic support are increasingly recognized not just for their impact on mental health, but for their potential influence on biological aging itself, particularly through their effect on telomere maintenance. Although they do not directly interact with telomerase or cellular replication, these interventions operate through a powerful and often underappreciated axis: the mind-body connection, which influences systemic inflammation, cortisol levels, oxidative stress, and ultimately, the rate at which telomeres shorten. Telomeres are especially sensitive to psychological stress. Chronic stress leads to sustained elevations in cortisol and other stress hormones, which impair DNA repair processes, increase oxidative damage, and accelerate telomere attrition. This effect is most pronounced in individuals exposed to long-term adversity, caregivers for dementia patients, those living with post-traumatic stress disorder, PTSD, or individuals with histories of childhood trauma often exhibit telomeres significantly shorter than their age-matched peers. In these high-stress populations, psychological interventions like CBT and emotional therapy have been shown in clinical studies to reduce perceived stress, normalize cortisol rhythms, and perhaps most remarkably, slow or even partially reverse telomere shortening over time. Cognitive behavioral therapy, one of the most evidence-based psychological treatments, empowers individuals to recognize and reframe negative thought patterns that contribute to chronic stress and emotional distress. By decreasing the frequency and intensity of stress responses, CBT effectively downregulates the physiological pathways that harm telomeres. Several trials have now demonstrated that individuals undergoing CBT show reductions in inflammatory biomarkers such as IL-6 and C-reactive protein, both of which are associated with accelerated telomere loss. Furthermore, participants in long-term CBT programs often show improved sleep quality and autonomic nervous system balance, both of which are conducive to better DNA maintenance and repair. Emotional processing therapies, those that involve identifying, expressing, and integrating unresolved emotional pain, may also play a critical role. Suppressed or unprocessed emotions, especially those tied to trauma or chronic anxiety, are associated with increased sympathetic nervous system activity and impaired immune regulation. When these emotional burdens are addressed, the body's stress response system begins to shift from a chronic fight-or-flight state to one that supports healing and cellular stability. Small but promising studies have found that patients engaging in emotional awareness and expression therapy show not only psychological improvements, but also measurable slowing in biological aging markers, including telomere length stabilization. Another promising area is mindfulness-based cognitive therapy, MBCT, which blends traditional CBT with mindfulness practices such as meditation and body scanning. MBCT has been shown to reduce rumination and emotional reactivity while increasing self-awareness and acceptance, factors that are critical in mitigating chronic stress. One study of breast cancer survivors found that participants who engaged in MBCT exhibited longer telomeres compared to controls, even after adjusting for demographic and medical variables. These findings suggest that structured psychological support may have tangible benefits at the cellular level. Importantly, these psychological interventions often create positive behavioral ripple effects. Individuals who undergo CBT or emotional therapy frequently experience improvements in other areas of their health: better sleep hygiene, healthier eating habits, increased physical activity, and stronger social connections. All of these changes independently support telomere maintenance, making psychological therapy a gateway to broader lifestyle transformation. In this way, the mind and body work synergistically. Not only does reduced stress benefit telomeres, but the behavioral improvements that follow further reinforce cellular protection. Even in younger populations, emotional well-being appears to be tightly coupled with telomere dynamics. Adolescents exposed to supportive environments and emotional regulation training show longer telomeres than those experiencing chronic emotional neglect or instability. This early life impact underscores the value of emotional and psychological care across the lifespan, not merely as a treatment for mental distress, but as a proactive investment in long-term cellular resilience. In summary, psychological interventions such as CBT, emotional therapy, and mindfulness-based approaches may not directly activate telomerase, but their profound influence on the human stress response offers a compelling path to preserving telomere length and slowing biological aging. By reducing cortisol, inflammation, and oxidative stress, and by empowering individuals to develop healthier thought patterns and emotional habits, these therapies offer a multidimensional approach to longevity. As scientific understanding continues to deepen, it's becoming clear that the health of our thoughts and emotions is deeply intertwined with the health of our cells. In this light, mental wellness is not just about feeling better, it's about aging better, too.